Thank you, everyone, and it's a real pleasure for me to be able to speak to you today a little bit about NIH and to listen from the folks here about the issues that they're having living with dysautonomia, so we can try to better execute our mission at NIH, which is to fund the research that leads to the medical advances that will improve health in the U.S. My institute is the National Institute of Neurological Disorders and Stroke, and we have, just to explain the institute a little bit, because it's often a mystery, we receive funding from the Congress, and you folks vote for the people in Congress, so you're responsible, and they charge us to use those funds in the best way possible. And in the U.S., over the years, a system has developed which has made us the leader in biomedical research. And so at NIH, we have basically two divisions. One is what we call the intramural division, which is research that goes on the Bethesda campus. And the other part is what's called the extramural division, and that sends funds out to universities, businesses, many other types of organizations around the country. About 90% of the funds go out to universities, businesses, and that's where the bulk of the research is done. And so you might ask how the decisions are made on where the funds go. Well, in the U.S., there is basically a democratic system. It's very similar to, say, jury by your peers. In the U.S., any investigator is eligible to submit a grant, so a proposal that comes to NIH. And that proposal then gets reviewed by peers who are picked because they have special expertise and also dedication to be able to spend time participating in the system. So they read these grants proposals very carefully, and then they give them a score. So they just rank them from 1 to 100. And what happens at NIH then is fairly simple. We start paying the grants that have the best scores, and we keep paying until we run out of money. And that's what we call the pay line. And that's how our system basically works, with some tinkering around the edges. And over time, that has really led us to the position in the U.S. where we are today. I could say that having visited other countries, the systems that they have really don't allow the type of innovation and free process that we have. Many of them are very top-down, and money goes to people who are known to the people who are making the decisions. Most of the money that we send out, I don't know who personally know those people at all. So our system is an incredibly democratic system, a very typical U.S. system. But I guess a couple of caveats then, because you are interested in a particular disease, dysautonomia, particular disorder. So the question comes, how do we get more research funding into our disorder? Well, from the system I explained, the answer is to work with physicians and scientists to try and capture their imagination to work on your disorder. And dysautonomia is a really interesting problem that is not well solved. So for some people who want a really good problem to work on, this is actually a really good problem to work on. And that's where organizations like yourselves can make an impact. As a government, we can't influence what someone works on. They work on things that they're passionate about. It's the patients who make the doctors passionate about what they want to work and spend their life on. And it's the patient organizations that have the power to reach out to groups of physicians like you're going to hear from today who have been hooked and dedicated their lives to work on dysautonomia. And so I I'm sure you came for a reason, to learn, to try and help yourselves with your disorder, live with your disorder, but realize you're having a much greater impact by being here, by making the impressions that you do on the physicians and the scientists that you come in contact with. So if I turn to dysautonomia research at NIH, I can make a couple of comments. In the intramural program, we are lucky to have Dr. David Goldstein, who's been part of this organization for a long time, someone who spent his whole life studying autonomic disorders. In the extramural program, there's a number of very high-profile projects that are going on now. Through another one of our organizations called the National Center for Advancement of Translational Sciences, NINDS and the other institutes fund what's called rare disease consortia. So these are investigators, usually from 3 or 4 different places around the country, who come together to work on a problem. Again, extremely important because these folks are much more powerful when they're working together than alone. And so NINDS is happy to fund the Autonomic Rare Disease Consortia, which is run out of Vanderbilt, but includes a number of other institutions around the country, including Intramural NIH, Mayo Clinic, and so they are, as you know, doing research on postural orthostatic tachycardia syndrome, looking at the autonomic inflammatory reflex, trying to understand if by stimulation of the vagal nerve in the ear, you can improve autonomic high-frequency heart rate variability, CNS symptoms, and orthostasis. This is interesting in the sense that they've been working in this area for a long time. There's another major program at NIH called the SPARK program. So it's stimulating the periphery for health. And here, what NIH has done is to put funds and try to attract investigators to spend their efforts understanding how we can stimulate and record from the nerves that are going to our organs in the stomach or the heart or the lung for health. An area that was quite well developed in the 50s and 60s, but has really fallen off in the last 20 to 30 years. Now, these people are particularly interested in building devices that you can listen to the activity in the nerves, and these are largely the autonomic nerves that are involved in these projects, and also to stimulate them for health purposes. So, for instance, Vitaly Napadow at Mass General is actually studying the auriculovagus nerve and its effect on cardioreceptors, so very, very relevant to POTS syndrome. Jeff Ardell at UCLA is developing an electrode system for listening to these cardiac nerves. Dominique Durand at Case Western in Cleveland is also developing a nano wire interface with the carotid sinus nerve, which of course is regulating blood pressure with position. So I think that that's really a good sign that this is one of the first major efforts to move the scientists, particularly the engineers, into the peripheral and autonomic nervous system. There's also a really interesting story, I don't know if people know, about familial dysautonomia. So it's a rare disease, but it's quite severe, often fatal. And there's a story which kind of illustrates what happens in science sometimes, which is you can't really predict where the benefits of something will end up. So the story is that in the 90s, in the early 2000s, NINDS, our institute, tried to set up a screening program to find drugs that would prevent neurodegeneration, so the death of cells that occurs in Parkinson's, Alzheimer's, ALS. And one of the drugs they found was called kinetin, and it's a plant protein. And what it was found to do, it was found to change how the cells in the body read DNA. DNA is where your genes are. These genes are then read to form proteins, which are the building blocks of the nerves, for instance. So this kinetin affected the way in which the DNA was read. And it turned out that in familial dysautonomia, one of the problems is that a part of the gene was skipped when it was read. And kinetin prevented this exon skipping. And so the work that was done to develop this drug for neurodegenerative disease was actually found to be really important for familial dysautonomia because it prevented this exon skipping that occurred in the gene that causes familial dysautonomia. And this was work done by Dr. Slauenhapt at the Mass General Hospital. And we have programs at NINDS, particularly for rare diseases, to try to take therapies through to the point that the FDA will approve those therapies to test in patients. So Dr. Slauenhapt came in with the kinetin knowledge and developed a program that we funded over 5 years to test what doses is it safe, and now is in the process of going into patients again. So an interesting story where, again, really impactful on the patients, could be very impactful on the patients who have this disorder, but not something that you could have predicted when the projects first started out in the 2000s. In terms of dysautonomia, the other areas that I think are very interesting at this point in time for research are the autoimmune basis of the dysautonomia. So especially you'll hear from the folks today who have been working in this area the last 20 years, but the question is how much of what we see in dysautonomia is due to the immune system attacking the nerves of the body. So in certain instances, we know there are antibodies against proteins in the autonomic nerves, and some of these patients will get better when you treat that autoimmune disorder. There's something else which I'm not sure how this will play out, but another condition called myalgic encephalomyelitis, chronic fatigue syndrome, often termed MECFS, is a disorder that affects a large number of people in the United States. It's been very poorly studied. POTS and dysautonomia is a component of that disorder, along with very severe exercise intolerance, a sense of fatigue, leading to fairly significant disability. So Dr. Collins, who's director at NIH, has led a program to try and get research started in this area. The research in the areas, there has been some, but it's really been quite low level. So what we've been doing, we started a program in the intramural program, and Dr. Goldstein is part of that, to try and understand what is wrong with people with MECFS, and we'll have centers around the country soon that will try to coordinate MECFS research, much like we have now for autonomic rare disorder research. Much of the problems that people deal with dysautonomia related to the peripheral nerves. We certainly fund a lot of research trying to understand peripheral nerve disorders and peripheral nerve function that may be relevant. And finally, the other area, which is hopefully not something that you run into, but you may know that there are other disorders, neurodegenerative disorders of the brain, particularly those involved in the deposition of a protein called synuclein that causes Parkinson's disease, multiple system atrophy, and those disorders have a large autonomic component to them. So at NINDS, the answer when people say, are you funding enough research in my area? The answer is always no. We never fund enough research. We basically fund as much as we can for the funds we have. But we try and make an impact, and I think scientists spend their career trying to make an impact for people such as yourselves. And sometimes we get lucky, but the persistence will always bear out over luck. So again, I just want to thank you for asking me to come today, and happy to chat with people. Thank you.